Hi everybody, welcome to Healthline. I am Gregory Zarian. It is October, and October is Breast Cancer Awareness Month. I've got my pink on. Do you have yours on? Pink is the conversation about breast cancer awareness. What do you know, what don't you know, and what information can you pass on to your friends? Let me share with you a statistic that you can pay it forward, because our conversation is all about keeping you as healthy as possible. 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. And gentlemen, did you know that out of every 100 new diagnoses, 1 to 3 are men? Those are staggering numbers, but we're here to share with you that some of the numbers have gone down in great healthy ways. Joining us from Adventist Health Glendale is Dr. Mihran Shirinian, specializes in oncology and hematology. And joining us as well is Dr. Ami Patel. She also specializes in hematology and oncology. Doctors, welcome.
Thank you.
And you've been here before, so I love that you keep on coming back and wanting to pass on the conversation of breast cancer awareness. 1 in 8 women, doctor. But we were talking during one of the breaks that some of the fatality rates are getting better. Not as many women are passing away, even though 1 in 8 women will get diagnosed. Why is that?
Yeah, so the incidence hasn't changed. Actually, it's a little bit higher. But the issue is that more women are either cured or they survive longer, even if they're not cured. So the numbers, again, are about 250,000 newly diagnosed cases of breast cancer in women in this country per year, and only 40,000, only meaning that still it's a high number, but compared to numbers before, it's much lower. Only 40,000 die per year.
So Dr. Patel, why is it getting better? What are you doing? What are we doing?
So I think, as Dr. Shirinian mentioned, the number has maybe in fact increased because we're doing more appropriate screening.
Love that.
We're doing mammography on a regular basis. That's a recommendation. And therefore, we're picking up cancer more than before, which is in a way a good thing, because we're picking them up at an earlier stage rather than finding them out at a later stage or when the cancer is advanced. So the incidence is increased because of that as well, just by doing simple screening mammography. And patients are living longer because of the rapid advancement in the medical science with the improved, not just chemotherapy like in old days, but now we're doing more targeted therapy, immunotherapies, and therefore the mortality has gone down.
And more people are talking about it. You have your pink on, I have my pink on. I know you have pink in your heart. I know, but more people are talking about it, and I love that it's a conversation piece. Like, what does this mean? What does that mean? You know, you said something about, getting screened early.
Yes.
One thing that's super important as well is doing self-exams, checking out your body, seeing what your body looks like. Because we know what we look like better than anybody else. We know what our feelings are. So it's great that the conversation is shifting. Yeah. Doctors, I have tons of questions when we come back. More with Dr. Patel and Dr. Shirinian when we come back. And I have a question. Let me see if you know this. What is the most commonly diagnosed cancer in women? More on breast cancer awareness and all you need to know when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. The entire conversation today is all about breast cancer awareness. But before we dive into that, I'm sure you've noticed that Adventist Health has a new look. Same mission, but just a new look. We are now known as Adventist Health Glendale. And did you know that U.S. News and World Report names Adventist Health Glendale among best hospitals, ranking number 16 in the Los Angeles metro area and number 28 in all of California in high performing in 5 categories of care. So if you were wondering what hospital you need to go to, you need to look no further. Before we wrapped out the first segment, I asked you a question. What is the most commonly diagnosed cancer in women? It is breast cancer. Joining us from Adventist Health Glendale is Dr. Ami Patel and Dr. Mihran Shirinian. They both specialize in oncology and hematology. Doctors, before we talk everything breast cancer, share with us a little bit of your medical history, Dr. Patel.
In terms of the training?
Yes.
So I was trained medical school in India, in Pune University, And right after finishing my medical school, I migrated to United States with the dream of pursuing the same medical career here. I did my residency the first 2 years at Louisiana State University in Shreveport. I was transferred to Greater Baltimore Medical Center in Baltimore, Maryland for the last year training. I actually pursued general medicine career for almost 7 years here in Glendale. Enjoyed it thoroughly, and during that work, oncology and hematology really inspired me to pursue specialization. Went back to my love affair with LSU, Louisiana State University again, and did my fellowship there. Thoroughly enjoyed it, and I'm back in Glendale to join Dr. Shirinian's fantastic,
welcome back.
inspiring practice.
And doctor, what got you involved? What is your medical history?
Yeah, so I did I graduated from Cairo University in Egypt Medical School. I did my training at Cook County Hospital and University of Chicago. That's the internal medicine. Medical oncology, I did my fellowship at MD Anderson Cancer Center in Houston, and then stayed on staff for 3.5 years. I was an assistant professor there, and then moved to Glendale. So this is my 25th year in Glendale.
Happy 25.
Yeah, thank you.
And I want to go to India and Cairo, so next time you guys go, I'm coming with you.
You should, absolutely.
Let's start. What is breast cancer, Dr. Patel?
So just like any other cancer, breast cancer is an overgrowth of some of the breast tissue cells that have gone sort of out of control and become autonomous.
Okay.
And now it's just growing out of control, and it could, if it's early stage, it can stay within the cancer, and some of the aggressive breast cancer will make it out of the breast tissue, goes to the lymph nodes in the neighborhood or regional.
Which means it's
spreading, or go to the distant sites of the rest of the body and metastasize.
Doctor, is it hereditary?
Well, a small percentage is. In about 6 to 7% of the breast cancer cases, it's hereditary. In other words, BRCA1, BRCA2 mutations can be identified and found. But the vast majority of breast cancers are not. In other words, they do have mutations, most of them, and it's acquired mutations. They're not genetic, they're not inherited mutations. And so not having the inherited BRCA1, BRCA2 does not give you that security that you're not going to develop breast cancer, because again, over 90% of breast cancers are de novo. It's not an inherited family issue.
So then how does somebody get breast cancer? Is it just your cells turning against you, Dr. Patel? Is it environmental?
There are a few factors involved, so definitely, as Dr. Shirinian mentioned, that genetics plays an important role.
Okay.
So if you have some of those inherited mutations existing in your body, then you're naturally prone to develop breast cancer at some point in time in your lifetime. And then if you are exposed to any number of the environmental factors, which are called carcinogens, that
Such as?
means obesity is number one for breast cancer.
Oh, really?
Actually, it's not number one, but it's one of the, I would say, first number 3. But hormones,
Okay.
exposure to hormone, increased number of estrogen exposure
Such
in
as?
many different ways, such as birth control
Okay.
pills, hormone replacement therapies in
Okay.
the menopause, or early onset of menstruation.
Okay.
We call it menarche. And later age at menopause, that increases your exposure to hormone by increasing your menstruation cycling. Late onset of first full-term pregnancy,
Okay.
after age 30, for example. And similarly, nulliparity, that means never pregnant, or less number of pregnancy, less duration of breastfeeding. All of these increases your exposure to estrogen.
So it's basically your body just creating so much that can create an overabundance of estrogen, which can then contribute to breast cancer.
Well, you already have an existing estrogen, but
Okay.
the exposure varies depending on your
Okay.
pregnancy, or breastfeeding, and number of menstrual cycles.
But then Dr. Shirinian, if somebody in your family, because I truly, we're advocates of here, please check into your family history, men, women, ask your grandparents, everything. How old should a young lady be in regards to getting checked for the BRCA gene?
Well, I mean, we don't check for the BRCA gene unless a family member has the BRCA gene. Now, if a woman is newly diagnosed with breast cancer, then yes, you can check the BRCA gene. And the standard of care is if you're diagnosed under the age of 50 without any history, without any family history, then it would make sense to check for the BRCA gene. Now, if you do have a lot of members in the family that have breast cancer, then yes, I mean that raises the possibility that you might have the BRCA gene. But at the age of 40, every woman should get screened, at least get the first mammogram, and then after that continue getting yearly mammograms, because up to the age of 55, the rates are pretty high, so they need to get it on a yearly basis. And the recommendations nowadays are beyond the age of 55. You can either do it yearly or every 2 years. We still, in the medical oncology field, recommend that women get yearly mammograms, but some centers have switched towards doing it every 2 years.
Which has completely changed. More on breast cancer awareness, and when you come back, I'm going to share with you how to do your own self-exam. Don't go away. Welcome back to Healthline. It's all about Breast Cancer Awareness Month, and I've got my pink on. Dr. Ami Patel has her pink on. Dr. Mihran Shirinian from Adventist Medical Health has his pink on. Do you have yours? Doctor, we were talking about possibilities in regards to women and breast cancer. There's something you said during the break about no one being safe. What does that mean?
So just because I mentioned about some estrogen exposure, increased risk, lower risk if they've been pregnant before a certain age, that all of the above said, nobody is still spared of the risk of breast cancer. As earlier you mentioned that 1 in every 8 women has a lifetime risk of developing breast cancer. That's an average risk. That applies to every woman, regardless of their
every
exposure.
2 minutes a woman is diagnosed with breast cancer,
Correct, yes.
and 1 woman will die of breast cancer every 13 minutes.
Yeah. So having said that, everybody should, as Dr. Shirinian mentioned, should follow the screening guidelines for mammography.
But in regards to the ages of, you said from 40 to 55.
For sure they need to get it on a yearly basis. Beyond the age of 55, I would still recommend yearly mammograms.
Absolutely.
Yeah, but I mean, some centers would say every 2 years would be fine. I mean, certain countries like Canada do it every 2 years, but I think doing yearly mammograms is probably the best thing to do.
And one thing that we've talked about here on Healthline is if somebody in your family has actually, in fact, had breast cancer and they have been younger, then you need to go to your doctor and get checked.
Right.
In regards to the same age.
Yeah. The standard of care is if you have a close family member that was diagnosed with breast cancer.
Per se, mother-daughter.
Yes.
First-degree relatives.
Yeah, first-degree relative, say at the age of 40,
Okay.
you need to get screened at the age of 30, meaning
Okay.
10 years before the time they were diagnosed age-wise.
Okay.
And you don't need, obviously, mammograms every year when you're 30 because that's not good for the breast to be exposed to much radiation. But at least get regular checkups and maybe mammograms every 3 years or so.
Okay.
But again, so the standard of care is to start checking 10 years prior to the member of the family that was the youngest at the time of diagnosis.
And doctor, real quickly before we go through the self-exam, can men be connected to the BRCA gene as well?
Yes, men that have the BRCA gene have a very high incidence of developing breast cancer, almost like 50%. While men that don't have the BRCA gene and it doesn't run in the family have a very low percentage of developing. Yeah.
When we wrapped out, I talked about self-examining. In the intro, I always say you are the captain of your ship, and I invite people to really take a good look at their body and see if there's something different. If you're in a relationship, check each other out and see, does this look different? Does that look different? I invite everyone to do your own self-exam.
Absolutely.
So, Dr. Patel, just walk me through it. And this is for men and women.
Absolutely.
So, tell me what we exactly do.
So first of all, as you said, everybody should be familiar with their own body. So, and you're the first person who can recognize any change. So the first thing is to stand in front of the mirror with your shoulders relaxed and your arms bent at the elbow, with your hands resting on the hip or somewhere on the side of your hip bone, and just directly look in the mirror and try to notice any asymmetry in both breasts. It may be different size, the shape looks different, or the color of the skin, or any changes in the nipple. Okay, and if there is any the way that your breast is falling, maybe a little bit lifted, that means there is some retraction of the breast tissue from within. That could be also a sign of asymmetry or change. Again, some females do have differences in their breast, so it is important again to know your breast and act on any change. That's very critical. Also, any bulging or redness of the skin. Bulging is obviously a sign of the lump, and if you feel a lump underlying, that's critical to get checked. Redness of the skin, any nipple discharges of any color, clear, milky, or bloody discharge, or sometimes the nipple looks dry or eczematous, or meaning there is like a rash or crusting. Those are also signs of some cancer. That would be the first step to check in a standing position. Next thing would be still remain standing and raise your both arms, go above the head, and still again look for.
Too. Even if you're, I mean, it's more specific with women, but if your pec looks different, if your nipple looks different.
Absolutely.
Do men get discharge as well?
They can.
Okay.
Yeah.
So raise your hands above your head.
Absolutely. So do that way, and again, look for any asymmetry in that pose, and look for any asymmetry or the way your breast is looking. Next step is to lie down flat with your arm raised. Let's say if you're doing a right breast exam and you raise your right arm and use your left hand to check your right breast. Okay, so lying down supine, meaning flat on your back, and checking to make sure that you're doing a thorough breast exam. It would be using your flat of the finger pad, maybe the first 3 fingers, let's say, to remain more organized so that you don't miss any spot in the breast. The best thing is to go from top to bottom, and maybe pick a clockwise or anti-clockwise direction. So you go in one direction from top to bottom, from all the way from the collarbone down to the upper part of the abdomen, so you cover entire breast. And similarly, from starting under your armpit or underarm all the way to the midline, which is the center of the chest. And this way, kind of going in a circular fashion with the flat of your hand, maybe in the quarter size circular fashion. And that way you cover your entire breast tissue.
And then once you're done with that side, then go to the other side.
Then go to the other side, absolutely, with your left breast, right hand.
That's great, doctor. And here, one thing that we talk about all the time on Healthline is, you know, when you're in the shower, just check out your body. Raise your left hand, do a quicker check, left hand, and same thing, doctor, in regards to gentlemen checking your testicles. You know if something's off, and if something's off and doesn't feel good, all you have to do is call your doctor. More on breast cancer awareness when we come back. Do not go away. Welcome back to Healthline. I am Gregory Zarin. The entire conversation's been about breast cancer awareness, and we just talked with one of our guests, Dr. Ami Patel, about how to self-exam, and her partner in health is Dr. Mihran Shirinian, and they're both from Adventist Health in Glendale. Doctor, when somebody has been given the diagnosis of breast cancer, people think it's a death sentence. But during one of our breaks, we talked about how far we've come. Please share with us some of the great medical advances.
Okay. I mean, a lot of things have changed in the treatment of breast cancer over the last 20 years or so. So now we're more able to identify exactly what type of breast cancer you have. So breast cancer is not treated as a whole. Breast cancer is treated in separate subsets of groups. So we can identify exactly what group, exactly what mutations you have, exactly what abnormalities you have, whether hormonal treatment is appropriate, whether combinations of hormonal treatments with other compounds. So we have more specific diagnosis now in trying to put patients in different groups. So we have the HER2 positive patients, we have the HER2 negative, triple negative patients. So there are many, many subsets of patients. And because of that, the treatments are more targeted rather than haphazard like it used to be before. So now we can identify patients that actually need chemo versus not needing chemo by doing specific tests like MammaPrint or Oncotype DX. We can identify the patients that are triple negative that need to be treated in a completely different fashion than someone who's triple positive that would get combinations for their HER2 positivity.
Instead of the same treatment for one thing, it's more targeted, it's more specific.
So over the last 20 years,
love that.
more and more subsets of patients have been developed. And by developing those subsets and by being able to treat those subsets differently, the outcome has significantly improved. And again, we're talking about patients that have more advanced disease. The ones that have a very early disease can be cured just by surgery, or maybe surgery with radiation therapy if they get a lumpectomy versus a mastectomy, or maybe hormonal treatment if they're ER/PR positive. But even the more advanced patients or the bigger tumors that used to be a challenge 20 years ago have become much easier to treat now, again because of the advancements in medicine and the advancements in the therapies that are available to us, and being able to target it specifically for the need of that particular patient.
In regards to therapies, everyone has an opinion.
Mm-hmm.
Doctor, what are your thoughts in regards to integrating Western medicine with holistic therapies?
Absolutely. So we encounter those questions all the time. And even patients come and ask us herbal supplements. So what my personal recommendation is, I totally respect, and it is important for their overall well-being. There is proven data on holistic medicine or alternative medicine supplements. What we tell patients that it shouldn't, I'm a medical oncologist, I'm not a holistic medicine doctor, but I do respect those. I tell my patients that try not to put them together, especially herbal supplements, because we just don't know how they interact. Chemotherapies or known medications such as Tylenol or what have you, those are well studied and we know their interaction. Herbal supplements, they're medications, they work on your body. They have their set of side effects, and when you combine them with while you're getting chemotherapy or your pharmaceutical medications, we don't know how they're going to interact, whether they're going to make the other work better or more or less. Toxicities may increase, or it may make the other therapy work less effectively. So I tell my patients, try to do those in between your chemotherapies, or when you completed your treatment therapy for the cancer with us. I totally encourage them to do what they feel that's important for their body.
But the most important thing, though, is to talk to your doctor.
Absolutely.
And one thing, too, that we talk a lot about is don't self-diagnose online. Talk to your doctor. Great statistic. Over 3.3 million breast cancer survivors are alive in the United States today.
Mm-hmm.
Talk to us about just being healthy and health and wellness and preventing breast cancer. Doctor?
Yeah, I mean, again, there are certain habits that are important in preventing breast cancer. Again, like living a healthy, having a healthy lifestyle, exercising is very important, not being overly obese is important, not drinking too much alcohol.
Quit smoking.
Well, quit smoking is a must for everything in the body, not just for breast cancer. But specifically for breast cancer, less alcohol or no alcohol, a better body weight and more exercise are simple things that can be done that might help. Again, no one is safe, but again, you'll be in a better place doing those rather than having that added problem on top of the statistics of 1 in 8 being diagnosed with breast cancer in their lifetime.
Doctor, final thought in regards to breast cancer awareness?
I completely agree with everything we discussed, and I think being aware of your body, be more proactive about taking actions, know what's wrong with your body. Do not hesitate in consulting with the skilled physicians who are much better at guiding you than, as you said, just looking up on website. Take actions to be healthy, make healthy lifestyle choices, do screening mammograms. If there is anything wrong, if you feel and you don't know what to do, talk to your best friend or talk to your partner and take actions. Go see the doctor, and don't be afraid of the diagnosis given. If it's cancer, sometimes it's as simple as stigma. They know that it's a lump in their breast. And I recently had a patient, for 2 years she was hoping it would go away, and finally came at when it was completely riddled skeleton structure. So please don't do that. We found out that it was what Dr. Shirinian mentioned, triple positive. It was hormone receptor positive, HER2 positive. This could have been cured. So take actions, exercise, obesity, as you said, smoking, alcohol. Do better healthy choices in your lifestyle.
And have a conversation about your health. And one last thing that I want to
Yes.
say about breast cancer is, ladies, if you go in and you get a cloudy mammogram, it could just be that it's a cloudy mammogram, where they will then send you to get an MRI. Doctors, thank you for saving lives and having the conversation. Okay, so why don't you have the conversation? Why don't you throw on your pink and get involved in breast cancer awareness? I'm Gregory Zarin. You can find us here at Adventist Health Glendale 24/7. If you have any medical concerns, please call the physician hotline at 818-409-8000. Remember, the most important conversation you are going to have is about your health. So start talking now. We'll see you next time. Take care.